joining us for today's webinar, Fintech for All, Why Technology Accessibility Matters. We'll go over some Zoom logistics before we dive in. Next slide, please. We welcome your questions for our presenter today. Please use the Q&A box to share those questions at any time during the presentation. And you can find that box on the bottom of your screen towards the middle of the screen. Next slide, please. You'll be in listen-only mode today. You won't be able to unmute yourselves, but if you would like to access closed captioning, please select closed caption. That's also at the bottom of your screen to the right of the Q&A box. Next slide. While we want to foster an open dialogue and create an atmosphere of trust, we do want to be aware of what may appear to be antitrust conflicts. So here at the Financial Health Network, we abide by and require our attendees to abide by the spirit and letter of antitrust laws. I'll go ahead and introduce myself. My name is Amelia Josephson. I'm a manager here at the Financial Health Network and the program lead on the Financial Solutions Lab Exchange. I'm delighted to have with me today Michael Rausch, Director of the Center for Disability Inclusive Community Development at the National Disability Institute. For our agenda today, I'll tell you a little bit about the Financial Solutions Lab and the Exchange for folks who may not be familiar. And then we'll hear a presentation from Michael, after which I'll pose a few questions to Michael and we'll share your questions from the Q&A box as well before I close us out. The Financial Solutions Lab is a $60 million 10-year initiative managed by the Financial Health Network in collaboration with founding partner JPMorgan Chase and with support from Prudential Financial. The lab's mission is to cultivate, support, and scale innovative ideas that address the needs of populations facing acute and persistent financial health challenges, including communities of color, women, older adults, and people with disabilities. Within the lab, the Exchange supports nonprofit fintech partnerships to advance a more inclusive fintech landscape, resulting in more products designed for and delivered to underserved communities. The Exchange provides a membership and grant program that enables nonprofits and fintech providers to collaborate and swap insights on building high-impact partnerships to further financial health. And with those introductions made, I'll turn things over to Michael.
Great. Thank you, Amelia. Can you hear me okay? Making sure I have everything unmuted here. Well, thank you, Amelia, and thank you to the Financial Health Network team for inviting me to come and speak with you all today on why technology accessibility matters. ADI has attended the Emerge conferences and been a part of the Exchange for several years now. And I think the very first conference, this was back when it was CFSI, was the Miami conference that we went to. So we really appreciate this opportunity to continue the conversation on accessibility and the inclusion of people with disabilities. Today, I'm going to share some information with you on who people with disabilities are. I'm also going to share some data on the financial needs as well as the purchasing power of our community to hopefully create that conversation on the importance of making products inclusive and equitable for all. Right, as we do in all of our presentations, we believe it's very important to leave folks with some resources and tools that they can take to learn more. So we're going to spend some time at the end sharing some resources with you as well. Before we get started, though, I kind of want to frame some of this conversation as well. You know, the use of technology is not new to the disability community, as we've long used assistive technology to assist in our work and participation within our community and in our personal life. We also have states who have signed on to be a technology-first state. what that means is that to be a technology first state is where these states are saying that the use of technology should be one of the first things to be looked at for persons with an intellectual or developmental disabilities. So technology is really an important piece for us. The other piece about technology within the disability community is, voice-activated supports were available in the 80s in some form to assist people with disabilities. And today we see voice-activated supports like Siri and Alexa and additional pieces as well. So, we've had this use of technology, but as we have this conversation, the one area of technology that we're still needing more advancement in is in fact fintech, and having accessible products that can assist people with disabilities build their financial lives. I think today this opportunity to speak with you, I hope will inspire you to help build the bridge of building products and services that are inclusive to all. So with that, let's get started in our conversation. Can we put up the first polling question, please? Okay, so our polling question's coming up. So I'm going to read the question. Please share your response. The number of individuals with a disability that use your product or service. So estimate that number. Is it none? You can choose very few, around 20%, 1 in 5, more than 20%, but less than 1/2, half, or more than half. So spend a few seconds to answer the question. And this is whether you're a fintech, providing a service, financial service, or a nonprofit. That's fine. So please answer it. All right, so we close out the poll. So in the responses, it looks like 4% said none, 32% said very few, around 20%, about 36% said around 20%, so that received the most. 15% stated more than 20%, 2% said half, and 11% said more than half. Perfect. As we go along, you're going to learn more about the disability community. And we didn't put this as a polling question after that, but once you understand who people with disabilities are, it's usually the number changes. But thank you for sharing this response. So as we get started, I guess I should tell you a little bit about the National Disability Institute. And so at the National Disability Institute, we are a national nonprofit organization where we're dedicated to building a better economic future for people with disabilities. At the National Disability Institute, we were the first national organization committed exclusively to championing economic empowerment, financial education, asset development, and financial stability for all persons with disabilities across the spectrum of disability. At the National Disability Institute, we affect change through public education, policy development, training, technical assistance, and innovative initiatives. To learn more about the National Disability Institute, please go to nationaldisabilityinstitute.org. Before we move on to the next slide, I want to do one more polling question. Don't worry, we only have 5 polling questions total for the entire presentation, but we're going to get a couple of them in here at the beginning. So if we could put up the next polling question, please. Thank you. So we want you to share which of the following are types of disability: a person with a mental health diagnosis, a person who is deaf, a person who has Down syndrome, a person who has epilepsy, or is all of the above an option? Take a moment to answer the question. Excellent. All right, of course, 99% of you shared that each of these are types of disability, of all of the above, and that is correct. Oftentimes in our work, we find that not everybody's familiar with who people with disabilities are, or might not think that an individual who has a hidden disability, like a mental health diagnosis, is considered a person with a disability. So thanks for answering this question. Next slide, please. So we want to understand a little bit more who people with disabilities are. So we want to put here the definition of what is disability. So the Americans with Disabilities Act, in case you're not familiar with it, it's this amazing civil rights legislation that was passed in 1990 that protects individuals with disabilities. And the Americans with Disabilities Act defines disability as a physical, a sensory, a cognitive, or mental impairment that substantially limits one or more major life activities. Also, it's important to know that an individual's experience varies by a variety of things. So for one individual who is deaf, the experience for another individual who is deaf or hard of hearing might be different. So the individual experience varies by type of disability. Again, as we shared examples of disability, it could be an individual with a mental health diagnosis, an individual with a learning disability, an individual who has diabetes, an individual who's been diagnosed with ADHD, a variety of different types of disability. The individual experience also varies by severity. An individual with cerebral palsy, who is a person who also uses a wheelchair, might have a different experience than an individual with cerebral palsy who, has high functioning abilities. So the severity is important to keep in mind. The other piece is age of onset. The experience that an individual has who is blind at birth is different than that may be for the experience may be for an individual who becomes blind at age 62. So that's an important piece. We also look at the interaction with the environment and the socioeconomic characteristics. But there's one common element here that I'm going to go into and share more, is that the risk of being excluded from the financial mainstream is across, impacts all regardless of their type of disability. I think it's also important to note here when it comes to disability is that it's important for you to know that, this is the one demographic that if we're not already a part of this community, already a part of this demographic, that at any time within our life, we could become a member of this community, as this demographic as well. Next slide, please. And really quickly here, I think this is really important for us to understand on the changing conceptualization and the definition of disability. And I put this in here because as we're talking about why technology accessibility matters and really understanding who people with disabilities are, that this is an important piece to note, particularly when it comes to financial services. So previously in our model, within the model or understanding disability, it was this whole charity aspect of it. That piece of, oh, that's such a tragedy, or oh gosh, poor Michael, and then it led to this piece of the medical model where it really started to look at, okay, disability is a condition and we're going to fix it. We're going to fix it. We can treat it, right? But really, the movement is switching to the social and human rights aspect of this, and really looking at disability as a socio-political construct. And when we look at that, we really look at this is that disability is an interaction between the person and the environment. People are limited by barriers in society, not solely by their impairment. These barriers can be physical, programmatic, or attitudinal. I share that because when we look at accessible products, right, as I mentioned, the voice-activated products or services like Siri or Alexa, even though that was something that benefited people with disabilities, it also benefits the larger community as well, regardless of having a disability. So it's important that as we look at products and services, of stepping back and thinking of, okay, is the interaction of this limiting the opportunity for a person with a disability? Perfect. Next slide, please. Oh, actually, we're doing a polling question next. See, thank you, Misha. I knew she was going to keep me on track here. So this question is, the number of people with disabilities in the United States is 10 to 15 million, 24 to 30 million, 40 to 57 million, or over 80 million. There's over 80 million people in the United States with a disability. So please answer this question. All right, so 2% said 10 to 15, 20% said 24 to 30, 32 said between 40 to 57, and 47 said over 80 million. The correct answer is those who said 32% of 40 to 57 million. So we know that based on the census and the data that 40 to 57 million of the population, or 13 to 20% of the population, are people with disabilities. So this goes back to that initial polling question I asked of how many people with disabilities do you serve? Last year, we surveyed financial counselors and financial coaches to ask how many individuals with disabilities do they serve? The majority response said very few or none, right? But as we look at that, we found that it was because people didn't know who people with disabilities were, because we know that 13 to 20%, or 1 in 4, 1 in 5, have disabilities. So an important piece for us to look at. The other piece is that 26% of households in the United States have a child or an adult with a disability. Next slide. So if you have a product or your service is helping low to moderate income individuals, the disability community is that market for you as well. So the need for financial empowerment. We know, as I shared, 26% of working age adults with disabilities live below poverty thresholds, compared with 11% of those without disabilities. When it comes to employment, 37% of working age adults 18 to 64 with disabilities are employed, compared to 79% of those without disabilities. When it comes to earnings, we know that 51% are earning less than $25,000, compared with 37,000 of those without disabilities. We also know about the educational attainment that 55% of people with disabilities have a high school degree or diploma, or less, compared with 36% of those without a disability. Finally, what I want to share here is the housing costs, and I'm going to talk more about this in making the case, is 24% of households with a person with a disability pay more than 50% of their income for housing, compared to 16% with those with no disability in the United States. Next slide. We look at the financial stress among individuals, and again, this is why it's important to have access to Fintech products and those products that help individuals alleviate stress and really build their financial lives. We know that people with disabilities are 3 times more likely to have extreme difficulty paying bills. They're more likely to report that they could not come up with $2,000 if an unexpected expense. And they're more likely, they're almost 2 times more likely to skip medical appointments because of cost. And also, people with disabilities are more likely to miss a loan payment or be late on a loan payment, difficult overdrawing checking accounts, and then, of course, having the emergency savings. Before we go into the next few slides, we want to do one more polling question to help frame this piece on the importance of technology accessibility matters, why this matters for people with disabilities. So this question is, blank percent of people with disabilities that use one or more public benefit Is it 20% of people with disabilities, 35%, 50%, or 65%? Identify, please select one to fill in the blank there, the percentage of people with disabilities that use one or more public benefits. Great. So 41% identified that 65% of people with disabilities use one or more public benefit. That is the correct answer. Next slide, please. So we share this information because we think it's really important to really understand the financial lives of individuals with disabilities. And it shows that 65% of people with disabilities use one or more public benefits. And in the chart, that lists a variety of benefits like Medicaid, Medicare, military health, housing, disabilities, Social Security disability, supplemental security income, veteran disability income, and other supports like SNAP. We know that some of these programs are means tested or needs-based. And so the eligibility criteria include limits on income and assets. So one of the other key things that we've looked at the National Disability Institute is also looking at race, ethnicity, disability, and the intersectionality. And I wanted to share with you just a few points on this. If this is an area that you are working in and focusing on, we feel that it's important to share this. So next slide, please. So our research team looked at data from multiple sources that showed the disparities by race, ethnicity, and by disability, where Black Americans with disabilities face an even harder economic reality than either Black Americans without disabilities or non-Black Americans with disabilities. Why? As we looked at this, we see the overlapping inequality and inequity that people face systemic inequality based on race, ethnicity, and disability. We also, as we look at the why here, is that Black Americans with disabilities face unique systemic challenges as a result of their intersecting identities. And as we look at intersectionality, it really is that lens or that prism for seeing the way in which various forms of inequality often operate together and exacerbate each other. And the economic disparities affect how well different groups will be able to weather even these consequences of the COVID-19 pandemic. I'm going to share with you some links to some reports and briefs that you're going to be able to look at, but I wanted to take two of these key data points to share with you. Next slide, please. So when we look at poverty rate on the working age population by race, ethnicity, and disability, we see that the poverty rate among Black, Indigenous, and Latinx communities is higher than the rate of white communities, regardless of disability. You know, I need to back up for just a minute. You know, when we look at the poverty rate, and we look at the poverty rate and people with disability, we know that disability is both a cause and a consequence of poverty. So it's a cause because my disability might prevent me from fully participating in different activities, different financial services. But then it's also a consequence because I would not have access to those services due to the cost. So disability is both that cause and a consequence of poverty. And I should have mentioned that earlier, so I apologize. Again, regardless of race and ethnicity, individuals with disabilities are significantly more likely to be living in poverty than those without disabilities. And of course, as I mentioned, the highest poverty rates are among Black and Indigenous people with disabilities. On the next slide is a piece that I hope that you will take and really look at in the work that you're doing, and it really is the piece that we are looking at as well. When we look at the net worth by race, ethnicity, and disability status of the working age householder, right? And that's what this chart is showing. We see that the data only looks at working age households. And you'll see also that there's significant disparities by disability status and race. But here's the piece I want to highlight so that everybody sees. When we look at the net worth by race, ethnicity, and disability, we see that the Black households with a disability have an average net worth of only $1,282. Okay, let me say that again. A net worth of $1,282 compared to an individual who is white with a disability is $27,000. But when we also look at this for an individual who is white without a disability, $132,000 of that net worth. So again, we see this huge discrepancy when it comes to the systemic inequities that individuals who are Black with a disability experience when it comes to building their net worth and really building to achieve or have that financial future for them to achieve financial stability. Next slide, please. So as we talked about that, now I want to look at the extra out-of-pocket disability-related expenditures. So just like as you're looking at your product or your services that you provide, and as we look at the poverty level, it's important for us to look at that people with disabilities are less likely to be employed, as I mentioned earlier, less likely to have income from wages, on an average have lower wages, are more likely to be low or moderate income or live in poverty, okay, what we shared. Measurement of poverty, how is it measured? Poverty is measured based on income. The eligibility for means-tested, needs-based public programs is predominantly based on income. And these income measures do not consider for the additional out-of-pocket costs associated with living with a disability. As a result, they understate the true level of economic hardship for households that include a person with a disability. Next slide, please. So what are those extra costs do people with disabilities face? Well, there's indirect costs. We have the foregone earnings that people with disabilities have because they face barriers to work. Family members may have to reduce their amount of paid work to provide care for the individual. We've definitely seen that through the pandemic, but not only for people with disabilities, but also families with children, right? Being at home. And these indirect costs are captured when we measure income. The other direct out-of-pocket expenses are those personal assistance services, those out-of-pocket healthcare costs, those extra costs of housing that is creating it accessible and convenient. There's even more expensive cars to accommodate modifications, maintaining service animals, extra cost of food for special diet, and we put here, et cetera, et cetera, et cetera. And the team that put this together, Nanette Goodman, they also identified that there were hashtags where people were sharing the direct out-of-pocket costs, looking at hashtag disability tax or hashtag crip tax. So you can even find out even more there. Next slide, please. So the major finding here and the piece to share from this data on the extra cost of disability, which this research was supported by the FINRA Foundation, is that the researchers were using a statistical. They found that a household containing a working age person with a disability requires 28% more income to have the same standard of living as a similar household without a member with a disability, okay? So what does this mean? This means that for someone at the median income would spend an extra $17,690 a year. And so that's something really important for us to look at. And I did put the link here for the different reports that we're mentioning that you'll be able to download whenever you receive the slides. Next slide, please. So what does this mean? When we look at the poverty rates for households with adult members with disabilities, adjusted and unadjusted for the extra cost of disability, we look at this, that if the federal poverty level was adjusted for the extra cost of disability, the rate of poverty among adults with disabilities would increase substantially. We estimate that approximately 2.2 million more people with disabilities would be counted as poor. What would this do? This would expand eligibility for many health and public benefit programs that will allow and help lift an individual up. If you look at the screen on the left on this chart, you'll see, as we gave earlier, 24% of people with disabilities live in poverty. If we add in the extra cost of a disability, that rate is 35% of individuals live in poverty, of individuals with disabilities. Excellent. Next slide, please. So here's some links to reports from 2018 and also the 2020 brief that's specifically on race. I also shared the link on the extra cost of disability, so that's an important piece to look at as well. And there's other reports there that you can access as well as free supports. Next slide, please. So now, I shared with you the financial needs, the financial stress, hopefully to build the case that if you created products or services or providing services to LMI populations, you see people with disabilities need access to these supports, these tools that can help them build their financial future. But now let's turn the page here and look at the purchasing power of people with disabilities. And this is an important piece for us to look at. So although we shared that people with disabilities earn less money than people without disabilities, as I mentioned at the beginning, it's also a large and growing demographic. We also know that 490 billion in disposable income for working age people with disability. We know that the study shows 490 billion in disposable income. The other piece is that for many fintech, many organization companies, this is a new product. And the market potentially is even larger when one considers the friends, family, caregivers, colleagues, and others who are connected to consumers with disabilities. And I think the other key piece here is knowing that the societal shifts really point towards the growing numbers and the greater inclusion of people with disabilities in different programs and access to services. Great. We're going to do one more polling question. This is the last one, and then we're going to go into sharing with you some resources and then go into Q&A. So this question, on a scale of 1 to 4, how confident are you that your product or service is accessible to people with disabilities? And the next piece is, ignore the second piece. That was on my end. But answer the first part. On a scale of how confident are you with your product or service is accessible to people with disabilities? 1, confident. 1 is I'm not confident. 2 is somewhat confident. 3 is confident. And 4 is very confident. Take a moment to answer. Okay, so 24% stated not confident. 29% said somewhat. 24% said confident, and 22% said very confident. That's great. For those of you who did not rate very high and being confident, no problem. you're here today. You're here today to learn about the need, and now we're going to share with you some resources. And now you have a new resource that you can reach out to us at the National Disability Institute, and we can connect you with other resources who can help you look at your product and service. So let's look at some resources. First of all, if you're looking at your products and services and you have questions about the accessibility of it, and you want to learn more about what are the requirements under the Americans with Disabilities Act, well, you can reach out to the Americans with Disabilities Act National Network that provides information, guidance, and training on how to implement the ADA in order to support the mission of the ADA to ensure equality of opportunity, full participation, independent living, and economic self-sufficiency for individuals with disabilities. The civil rights legislation clearly states that economic self-sufficiency is one of those proper goals of the Americans with Disabilities Act. So you can learn more about the ADA network by going to adata.org. They provide a wide variety of resources and tools, videos, online trainings, different assessments, pieces that developers can use, can look at. They really provide a lot of great resources. Next slide, please. All right, so thanks to our friends at the Southeast ADA Center, based in Atlanta, who we've worked with for many years, helped compile a list on some tools and resources that you can access. Many of the fintech companies that have reached out to us and that we've worked with over the year, these are resources that they found to be very valuable and appreciative as they went back to look at the accessibility of their products. So the first is looking at the web accessibility principles and really assuring that website accessibility is your website is accessible. Also, there's a course here on Introduction to Digital Accessibility. Then one of the other pieces that I put in here was the business case for digital accessibility. And it goes into more of what I had shared about the business case in really developing and creating equitable tools for all. And then, of course, a resource on what is required on the Americans with Disabilities Act and different websites. So we shared that as well. Next slide, please. Now, these are some accessibility tools. Oftentimes people reach out to say, hey, is my tool accessible? So here's a way that you can do some initial checks. These are the websites that you can go to. One is Easy Checks, the first review of web accessibility. And you put the information in there and it goes through to see if your website is accessible to screen readers and then gives some additional pieces and guidance. Then, of course, the other one is the WAVE, which is the Web Accessibility Evaluation Tool. And you can access it at wave.webaim.org. Another great resource for you to access. It was also asked that I share information for organizations and looking at accessibility and accommodations. If I'm providing services and an individual requests an accommodation, what is that and how do I support an individual? An accommodation request could be an example of an individual who is blind or has low vision. They might use a screen reader, and so they would need maybe the materials in advance so that they can use their screen reader to read the information to them. But according to the Americans with Disabilities Act, any business open to the public shall make reasonable modifications in policies, practices, or procedures when the modifications are necessary to afford goods, services, facilities, privileges, advantages, or accommodations to individuals with disabilities. Unless that public accommodation can accommodate that making the modifications would fundamentally alter the nature of their goods, their services, facilities, privileges, advantages, or accommodations. So I read that full statement there. The other thing is, if you're looking at creating an accommodation statement, that this is necessary to ensure that people with disabilities know that your facility, your product is available in alternative formats, and that the organization is willing and ready to serve people with disabilities. We provided 2 links here on developing an accessibility statement, as well as a website on developing an accommodation statement. So we hope that you will check those out as well. Next slide, please. As I wrap up, I just have one more set of resources here. If you are looking to understand who people with disabilities are and understand more of the services and how to make your service more equitable, or if you want to reach out and really have your product marketed in the disability community, here's some quick reference guides. They're all free that you can go to on our website. Everything I shared is free, free resources. So first of all, we have quick reference guides on a variety of topics, including data collection, if you really want to understand the demographic for a certain area. Also defining disability. The other piece is understanding the disability service system. One of the things that we've really looked at, and we're doing something with Saver Lights, is really looking at the disability service system. Is how can we get Fintech into the disability service system? So that's a great handout. Identifying partners if you have questions, and then of course the financial status. And then of course we have a variety of briefs. If you go to this website, you'll be able to get a wide variety of resources and tools to help you build your awareness and also build your make your products available to people with disabilities. So next slide, as I know I'm coming up to like 2 minutes left in my piece here, and my time allotted is, I think we've all seen this image of equality and equity of individuals on the left-hand side, 3 individuals standing on a box. A tall individual is able to see over, the second person has just their head over, and then the third person under equality is looking through the crack. But when we look at equity, really, it's where we all have the same opportunity to participate and in activities and have the same participation in services. And, you know, at the end of the day, when we look at why technology accessibility matters, and looking at people with disabilities is really looking at equity and seeing that products and services are equitable to all, and that individuals keeping in mind about the services or how the product and service also can meet the needs of people with disabilities is important. As I mentioned, the Civil Rights Legislation of the Americans with Disabilities Act clearly states that economic self-sufficiency is one of the proper goals of our community. And for us to really, I believe, to be fully inclusive and engaged, and to build the financial wellness of individuals with disabilities, we need to have access. We need to have fintech products brought and tested within our community. Just like as we shared earlier about some products that were created and the use of technology in the states that have been technology first states, is we have this audience. The piece is we just need to make sure that it's equitable and accessible to all. We appreciate the work of Financial Health Network. We appreciate the work of the nonprofit FinTech Exchange over the years. And we appreciate the conversations we've had with FinTech companies who said, hey, I do need to make my product inclusive and accessible to all. And so we really appreciate that. On the next slide, you'll see my contact information. If you have any questions, looking for more resources, hey, if you got a great product or something, hey, hook me up on the exchange. Let's have a conversation. Let's connect you with some partners if possible. And let's see how your product or your service can help people with disabilities build their financial lives. Amelia, with that, I'll turn it over to you. I'm 1 minute over my time. I'm sorry about that, but thank you so much for having me here today.
Thank you so much, Michael, for that presentation. And I think those are great notes to end on, the resources that you shared to empower people today to take steps on their own. And then, of course, that equality versus equity framing, another great reminder. So we had some questions come in through the Q&A. One of which was about, any data or survey responses, any insights we have so far about the impact of the pandemic on the disability community.
Yeah, I'm sorry, could you repeat the question one more time? I'm getting distracted thinking I need one more drink of water, sorry.
Of course. Yeah, just anything that we know so far about how the pandemic has impacted the disability community.
Absolutely. So we hosted listening sessions early on, and then have worked with other partners on additional pieces that looking at the impact of the pandemic. We know, I didn't show the slide, but we know that early on in the pandemic, majority of individuals with disabilities lost a job, right? Like many Americans, and then still haven't made it back. But one of the key pieces that we're finding and experiencing, and it's really not so much unique to the disability community, we're also seeing this the aging community, but it's social isolation. For individuals with disabilities who had access to supports, who had access to programs, who had access to accessible transportation, those supports changed, right? So that led to more social isolation. One of the things that we're looking at moving forward is looking at what are those technology products, what are those fintech products that also not only work on the financial life, but also can help an individual address that social isolation. So that's been a key piece. Last thing I will share about the pandemic, which was interesting, is that with the stimulus payments, one thing that we noticed, we don't know for sure about all the data, but there was an increase in savings in an ABLE account, which is a tax advantage savings account for people with disabilities. So during the pandemic, we saw an increase of enrollment in savings.
Yeah, that's so interesting. I know my previous role was with the New York City Office of Financial Empowerment, which had collaborated with NDI and the Empowered Cities Initiative. And I know those ABLE accounts so important, but can also be tricky for folks to use, and managing the different asset limits and the potential for overpayment. So is that an area where you see potential for some sort of fintech solution or other technology products to help folks manage those accounts and smooth out their eligibility and avoid any gaps?
Yes. Thank you, Amelia, for asking about this. So this is an important piece because, we also have to understand that the disability community, particularly those who are receiving a needs-based benefit, who would be eligible for an ABLE account, had been told, you can't save over $2,000 or you're going to lose your benefits. Ingrained in our head, you cannot save money, you cannot save money, you cannot save money. So this is an audience that needs to learn and understand the savings behavior. What are those things that we can do? So this is where we believe that attaching fintech with ABLE account holders and ABLE accounts, we could see substantial change in the enrollment of ABLE accounts, but also in the increase in the savings in these tax advantage savings accounts. I will say that we are working with SaverLife to look specifically at SaverLife and ABLE account holders. Being very honest, one of the things is their products they made accessible, which is great. But some of the uniqueness of the disability community, we are still trying to iron out some of those pieces. But that's why I think this is really exciting work, because when we have the piece where fintechs aren't giving up, we're giving up, we're going to find a solution. And I think that's what's exciting about this work and the possibilities that we all have in the future in making our products available. But anybody have a fintech product looking at savings behavior, check out the ABLE accounts, because I think it's really a great demographic, excuse me.
Yeah, and is the collaboration with Saver Life that you mentioned, is that in California? We had a question come in about the Cal Savers collaboration and if there are any insights on engaging consumers and increasing take-up.
Yeah. So in our pilot that we had a soft launch of it. Now we're working out some kinks and going on to the next phase. It really will be open across the country. So we won't be focusing specifically in one area or one state ABLE program during this initial piece. But that person who's in California and talking about that, please reach out, because as it goes, we'll love to have you help distribute it to your market and your network in California as well.
Great. And will there be a financial coaching, any financial coaching content embedded as part of the collaboration with Saver Life around the ABLE accounts?
Yeah, so with it will be really, right now we're just testing the product, the Saver Life component, and but the individuals will be variety supports Saver Life as well. Regarding the financial coaching piece, though, financial counseling, is we are working with AFCPE during the pandemic, as they're providing free financial counseling coaching to individuals, not only with disabilities and without, to manage the stresses of financial stress during COVID-19. And so we hope that when this launches, that those financial counselors that are supporting people with disabilities or ABLE account holders would be within their piece as well. But we don't know, it's really a pilot. So it's kind of just like a dream we have of potential that it could be embedded.
Great. We had another question come in around, some of the providers and nonprofits and organizations in our space have their own internal kind of online case management systems that might not be accessible to employees with disabilities. So I think part of the angle is making sure that we're serving clients and consumers well, but also embedding these practices into our own workplaces. So curious if NDI has any resources or tips around that.
Yeah, so we do have a couple briefs on the link that I shared that really looks at the integrating of the different pieces with it. Also, as you're looking at disability, looking at the disability service system. There's a brief specifically like get some different steps to take and integration. So absolutely, please check those out, free to download. You can always reach out if there's one there that doesn't meet your need.
Great. A question about that balance between kind of assistance and autonomy, thinking specifically about fintech products designed to help people who need financial management support, get that support, from a trusted caregiver, for example, in a way that maximizes their autonomy. Is that kind of an area of products or area of concern that you're familiar with?
I can't give a specific example, but the question that is coming is really looking at the direct supports that individuals have to support them, and that they also have access to fintech.
I think it might be a question of cases where someone's caregiver is helping manage their finances for them, for example, or their family member, and really helping individuals with disabilities feel that they have, autonomy and that they can engage with the tool themselves as well.
I gotcha. I'm sorry, I understand. Yes. So that is a big piece because, we want to empower individuals with disabilities, those who might have someone support them. I'm an individual with a disability, so not all people with disabilities have those supports, right? They may not need those. But yes, Amelia, it's very important that, we believe that that financial access to those pieces, those products is very important. With our work with Bank of America, we really looked at how do we allow individuals and help individuals create and understand financial education? How can we help them, empower them to create a spending plan? So what we did is we created a way for an individual who has a low reading level and even has support to still be able to create a spending plan based on images and really be able to use that. So I share that because even if an individual has a guardian, a rep payee, lives in a group home where somebody else manages their money, we still believe that it's important that they have an interaction to understand their finances, but also have opportunity to be empowered to use these tools as well.
Great. And a question came through on the data side. You shared some great points around the intersection of disability with race and ethnicity. And a question came through on whether there's any data to share, and maybe this could be in a follow-up after the event, but around Asian Americans with disabilities and their financial status or their net worth, some of the data points that you shared.
Yeah, you know what? That's a great question. I'm going to go back and I need to go back and pull that specific pieces in the report I gave you and the pieces I gave you. It didn't. And I hope that person emails me because I will take that back to our research team and look at why that wasn't, or if there was a different piece. So we can get that. That's a great question to look at. Thank you for that one.
Yeah, certainly. And we've talked a lot about private sector solutions today, but are there some policy changes around these topics that are a particular priority for NDI that folks on the webinar should be aware of?
Yeah, I think one of the key pieces is accessibility, and really looking at that making sure that things are ADA compliant. Our products, just like our websites, is really an important piece. Financial services have to, banks, companies have to make their websites and products accessible. I say this because I think that would be an important piece, is that assuring that FinTech, when it's developed, is that it's created to meet the ADA guidelines as well, to be fully accessible. Because one of the great pieces we've heard and we've learned from FinTech companies is that, it's better if we understand, the developers understand ADA compliance early on than at the end or after the product's created, because then you gotta go and change things. So I think that's really an important piece. I also think that a key policy piece is that when we ensure that FinTech is accessible, that we look at how FinTech can really be used and embedded into the different disability service system to help individuals manage their financial lives.
Great, thank you. And if we didn't get to your question, we will follow up after the event. Thank you so much for attending, and please save the date for our April 7th and 8th Emerge Workplace event, which is a free virtual event exploring the latest trends and solutions for employers seeking to improve the financial health of their teams. There should be a registration link in the chat. And with that, I will close us out. Thank you so much, Michael, for your presentation, to my colleagues working behind the scenes to make everything go so smoothly today, and to all of you for joining us today. We hope to see you at a future event, and when we close this window, a couple of survey questions will pop up. We do appreciate you filling those out for us. Thanks again for joining, and have a great day.